Welcome back to the Voices of Healthcare Equity, part two in our conversation with dentist Dr. Valerie Mukanga. In part one, we talked about Dr. Mukanga's journey from being born in Belgium, raised in the Congo, and then coming to the United States, where she completed high school and dental school, and is now the owner of her own dental practice, Healing Wings Dental, in Texas for the last 8 years. We talked extensively about how oral health or lack of oral health care affects people's lives, including leading to death in Dr. Mukanga's own family, what healthcare, lack of healthcare coverage does for people's access to health and oral health and dental care, and Dr. Mukanga's own practice, how she works with people across culture and language to try to get them involved in dental care despite the barriers of insurance and fear and lack of understanding about modern dentistry and its ability to be painless or very close to painless. So, really excited to be back with Dr. Mukanga.
Yay. Thank you for having me back again.
So, let's see. Tell us what you think are the most important next steps for improving dental health care here in this country, and then what you think might work worldwide.
That is a loaded question. I think what would work best if I don't know. Like we talked about finances being a problem. We talked about even sometimes transportation being a problem. For example, for population who do or lack of information as well, or even language barriers. But I think that the lack of information is a key factor to try to tackle first. Because, for example, people who do have Medicaid here in Texas, there's a program that they have where they provide transportation for people who do have Medicaid, but a lot of people don't know about this. Literally, you can call Medicaid and say you have an appointment on such and such a date, but you don't have a ride, and they'll come pick you up. And then after we're done, you call them and they'll go drop you home. So lack of information is very very detrimental, and also information as far as like the importance of dentistry altogether and how it ties in with the your overall health. I think there should be like more campaign about this, and even less traumatic stories on maybe like I'll say on movies or sitcoms where anytime they talk in media about dentistry, it's not always, or it's mostly not in a true light. I know that they have someone was saying that they watched a show about how they dentists were able to help people, or a certain lady, with her smile. She didn't have she was lacking a few teeth, and she was a business owner, and they saw the need and actually were able to give her a brand new smile, and from there on she soared. There are many people who do those kind of things, and so can the information be more broadcasted, like things like that, and showing dentistry in a good light. I remember myself, I saw a show, and it was this one lady who she she had missing teeth, and she ended up meeting this wonderful man who loved her to pieces, and but she was still, she was embarrassed to go on a date, she was embarrassed to this and that, but then she was able to also be helped by by a dentist. And after that, I mean, she was just living her best life. So if even on cartoons, because we talked about anxiety, even if in cartoons it's possible to have, positive um, imaging about, dentistry, even with kids, showing them, how to brush their teeth, making that fun, that those kind of thing will cause people to be less stressed about going to the dentist. And I think so that's on the line of information. But about financing, I think, there's a problem because though I say we see Medicaid, we have seen that during COVID time, Medicaid was afforded to so many children. And so they were able to, well, they were not able to get the care that they need as well as they need because we could only do emergency treatment. But after that period of time ended, still, people started coming and they could get help. But it's been maybe a year or a year some change since Medicaid decided or started dropping so many people off of the program. So now you have families that were able to actually come who can't afford it anymore. So if we saw that the need was great, why is it dropped all of a sudden? And then another thing is, could it be possible that Medicaid is more um, pays more, the reimbursement gets a little higher. That way, more dentists can feel like they can actually, provide care for people, who are underserved and not feel like, they are going to go bankrupt. Could that be like a solution? Financially speaking, those are the kind of things that, I'm thinking. Those are maybe two areas that I think that we can kind of like, zone in and see how that can help. Really providing positive information, doing awareness, as far as the need for and the reason why oral health is very important is not a luxury. It's not, something that, oh, if you have money, yes, then you can afford it. It's really, it should be basic health for anyone. That goes in the US and that goes in the rest of the world too.
So, insurance reform and education. Uh, I'll say it out loud. If you're not willing to say it, I'll say it. Dental care should be part of all health insurance. There's no reason that your mouth should be excluded from
Mm-hmm.
the rest of your body
Right.
in taking care of your health. And there's a lot of good reasons why having that exclusion existing makes health outcomes worse. For diabetics, it's a disaster.
This is
It
true.
is a life threatening problem.
Mm-hmm.
For other people with immunocompromise, it is a life threatening problem. It leads to heart disease and heart attacks. It increases overall health disease burden for people.
Mm-hmm.
And in case the damage to people isn't enough and all you care about is money, it increases the costs of care for the whole system.
This is true. And another thing we should focus on is really, and that goes with awareness because prevention is so much easier and so much more cost effective. If people have, had the right information, they knew what they're supposed to do as far as like their daily routine. Brushing at least twice a day, flossing at least once a day. I mean, if you think about the cost of a toothbrush, toothpaste, floss, versus now you have like a full blown cavity, you now need a root canal, or now you have lost a tooth, and it's ideal that once a tooth is lost that you actually have it replaced because otherwise it can mess with your bite. Even with that, or you have enough teeth missing, you're not able to eat properly, you're not able to digest your food properly. So many people lose weight and all of those kind of things. So, it's important to really focus on preventative care, teaching people what they need to do, and, that they also need to go to see the dentist at least twice a day so that we can keep things in check. That's so much more cost effective if we're talking about the financing of it is so high, than focusing and zooming in on really coming in, on a regular basis will save you so much. That's going to also solve a lot of the problem.
I would love to see this as a basic part of elementary school teaching and health teaching. If we can get to children at an early age and teach them about the importance of brushing and flossing and the effect it can have on their life, then we can change the whole trajectory of their oral health for the rest of their lives.
I agree.
And on the other end of the life spectrum, you brought up when people have no teeth. This is a very common problem for our older generation.
Hmm.
When they have lost so many teeth and dentures become something that they can't afford,
Yeah.
they are left to live out a life that is removed from one of the most basic joys and pleasures we enjoy every day, which is eating.
Hmm.
So much of our life and emotion is tied to eating and the things that we eat. And when you take that away from people, you take away a huge part of the quality of
Hmm.
their life. And that's a big problem for a lot of older people who will live without teeth because they cannot afford dentures.
Hmm.
That is a shame.
It is. It is. And I mean, denture, it's like the it's great, but trust me, like when someone has an upper denture, because we talked about the joy of tasting your food, you can't really taste your food. So then if you can't afford denture, but if really the best thing was to have implant or to have bridges, you can't afford dentures, which is the lowest, of the less costly option. How about, if you were really trying to have something that was more effective, efficient for you, you know?
Yeah, this is a definitely a big problem.
Mm-hmm.
And it used to be pretty commonplace that most people lost their teeth towards the end of their life and they had dentures. That's from a different time, a century ago, when we didn't even live as long
Right.
and we definitely didn't have oral health. But with good dental care and oral health, m- people that take care of their teeth throughout their lives can actually expect in their 80s, 90s, and 100 years old to have all their teeth.
Exactly. Exactly. And that, is the difference between that particular generation and the generation now. Even though information is not, well spread out or spread, um, back then they didn't know any better. And at the time, there was not, the technology had not evolved so much. So what they had to do is you had pain, you had the tooth removed. But now you have so many more options. You can do fillings, you can do so much. You can have bridges, you can have implants. So if the people can have the information or even can, start with prevention or have the means, to get the treatment, that is so much better.
Okay. So, what is next for you and Healing Wings Dental? What would you like us to know?
Well, what I want you to know is that in our office, really what we really want to do and strive to do is to make people feel comfortable when they come in, because there is so much anxiety, as I was saying in the first part. A lot of people are very anxious. So in our office, when you come in, we want you to feel like you're a part of the family. We welcome you with a smile. It doesn't matter where you're from. It doesn't matter what language you speak. A smile is universal. Everybody understands a smile. So we are a very friendly environment, and we just try to make the people feel comfortable. I like to take my time with the people that we do see, because sometimes, anxiety can just be relieved by me asking the question, what happened to you? Why are you so anxious? Did you have, a bad experience in the past? Well, tell me about it. And while you're just talking about it, it's also already, part of your therapy. I have had a lot of patients, or quite a few patients, that were so anxious. I remember this particular one lady. She came in the first day, she came in with her daughter. Her daughter was doing her homework in the reception area, and she came with the daughter. And when she came, she said, I don't want you to tell me about anything except for this one tooth that's hurting. We said, okay, that's what we're going to do. So we just spoke to her about that one tooth. And then after that, she said, okay, so when I come, I can't do the treatment today. I need to kind of like regroup and think about it and come more relaxed. So she came in, and we were able to, when she came back, we did the treatment. And after that, she came now for a comprehensive exam. And then we did things like in part, we didn't do everything all at once to overwhelm. We work with the people, if you can handle more, we do more as much as we can, obviously, because there's a threshold of anesthesia we can use per day. So we don't want to go overboard just, to save on chair time. No, we want you safe. So now the lady, she comes in on her own. She comes in on her own. It's like, hi, how are you? Oh yes, I'm ready. So we're really wanting to really take care of as many people as possible. And hopefully in a few years, we are able to get more dentists, and maybe why not more locations, so that we can help even more people, you know. And provide them with great care, with lots of attention and friendliness.
Valerie, I'm going to ask you a tough question now. You know that this organization that I am championing is trying to reach people in low and middle income areas that are very under resourced by telehealth. And
Mm-hmm.
you and I had a fascinating discussion about this, and whether there's a role of dental health and dental care in telehealth in the future. I'm excited about the possibility of offering that to places like the Democratic Republic of Congo, to Kenya, to Uganda, to schools
Mm-hmm.
where children don't have access to dental care, and we can really have an impact early. What are your thoughts about dentistry in the telehealth in under resourced areas realm?
To me, honestly, what I think is this: I think that it would be beneficial. If it's in an area where you have great access, then I would say go, to a dental office, because obviously there is this tactile detection that we need to see in the mouth and actually put, our hands to it to see what do you have. But if it's an area like the area where my parents grew up, I had once when we had our conversation, I actually went and spoke to my mom. She was born, in the village, so they were telling me they didn't have any toothbrushes. They didn't have those kind of things. They were using some trees. She said some tree branches that they kind of frayed, and that's what they were using. Sometimes they made paste with charcoal and things like that. So to me, having even family, and that's probably one of the reasons why also, there were a lot of people who had dental issues coming from that area. So I think that it's going to be very, imagine if, they were able to have teledentistry at the time. It's definitely better than not having anything at all. So I think that, yeah, it would be helpful for communities that do not have, access. I think it would be great for that to be an option.
That's awesome. And we're just excited about the possibility of people listening to this thinking, wow, I could do teledentistry, because we would love to grow our community in Healthcare Alliance to offer that amazing resource for people that don't have it. And like you said, it's not meant to replace strong in-person care. If you have strong in-person care, then great, right? Go for it.
Exactly.
It's not meant to replace that, but it's meant to offer something, sometimes education, sometimes just information, but sometimes a just-in-time intervention for people that don't have another option.
Yes, I think it's a great option. It would be a great option for remote areas for sure. Because at least, you have, remember how I was telling you that there were some people that would just go to the guy in the corner and have their tooth removed. And I know, for example, my husband was telling me that there was this one person that that no, this one person going even to a dentist at the time, I don't know how many, probably a few decades ago, and they had a tooth removed, but they didn't even have any x-rays. And I'm like, how? Because you don't know if that those roots are like curved, or you don't know if like you're going to like impede like some nerves or something, so if at least we can have that guidance, tell them, okay, this is what we need, this is what we are looking at, so as to, if it's a simple extraction and you can guide them through it, or if it's something more complex, you'll be like, no, actually go travel 2 hours away to see, a dentist. I think it will be helpful versus everybody having to take a 5 hour trip for something that could maybe be managed in a remote area by, someone else. I mean, it's fair to the people. At least they get some kind of help.
Absolutely. And offering people help is important.
Hmm.
It it makes people understand that they're valued, feel seen, feel important. It builds trust.
Hmm.
These are all important things for making a better society. When you leave people in their times of pain and sickness to and turn away from them, that creates a trust, a distrust, and a resentment that carries on in for the rest of their life.
Right.
And that's detrimental to society. So, I mean, really doing whatever we can to help people in their times of need, I think, is so important for creating a future that we want as a planet.
Right. I completely agree with you on that.
Valerie, I know you completely agree with me. That's why I love having these conversations with you. You're definitely a very giving soul and driven. By wanting to help people. And I really appreciate that. And I appreciate getting to know you and more about you. How can our audience connect with you, Dr. Mukanga?
Yes. So we are Healing Wings Dental, and we are located in at 4101 West Green Oaks Boulevard, suite number 317 in Arlington, Texas. And our phone number for anyone who needs an appointment is 972-213-0202. Our website is www.healingwingsdental.com. And also on social media, we can be found by finding us at Healing Wings Dental on handles like Facebook, Instagram, LinkedIn, and also YouTube. That's where we can be found.
Well, if I were in the Dallas Fort Worth area, I would want you to be my dentist, and I would definitely be a patient at Healing Wings Dental. So I
I
hope,
feel honored.
absolutely, I would be there in a second. We'd never get out of the office because I'd be trying to talk, even with your hands in my mouth, going, whoa, whoa, whoa. But
Well, we will have that conversation because many dentists do that. They ask you the question when your mouth is open and you can't say anything. We all do that.
yes. Whoa, whoa, whoa. You are
The funny
very
thing is,
good.
you can understand some of it or a lot of it.
I know. That's why I'm like, you speak a lot of language, but you also speak mumble. I know you speak mumble. It's amazing that dentists can understand what you're saying. You don't even understand what you're saying, but they understand. This has been a great conversation. Thank you so much, Dr. Mukanga.
Well, thank you so much for having me. I truly appreciate the opportunity.
In today's podcast, we explored the vital role of dentistry and oral health in overall healthcare. If you're a dentist and would like to join our global telehealth team in providing this important care to under-resourced communities across the globe, please go to https://haew.org to learn more and perhaps join us. It doesn't take much, 2 hours. That's all it takes from your home to connect with a community that doesn't have access to dental care and change a smile, change a life trajectory. Listeners, we need your support too. Share today's episode, please, with a friend. Leave us a review, please. Reviews, woo! Interested in being a guest? Please email us and visit https://HAEW, Healthcare Alliance for an Equitable World, HAEW.org to learn more, join us, partner, or contribute. Please, all together, community, let's amplify the conversation for a healthier and more equitable world. And thank you, Dr. Mukanga, for being part of that conversation today.
Thank you for having me once again. I appreciate it.